Good morning, everybody. My name is Tom Bracken. I'm the president of the State Chamber of Commerce, and I'm pleased to be here today with the BIA. And we're very honored to welcome the Commissioner of Health, Judy Persichilli. My job today is to introduce our sponsors, but before I do that, I'd just like to say that, again, we're very honored to have the Commissioner here today. Look forward to hearing her perspective on the pandemic and yesterday's game changer, which I'm sure she'll talk about. Other than the governor, I think Commissioner Persichilli is probably the most recognized person in government in New Jersey right now. And from my perspective, one of the most respected. I've known Judy for many years, going back to my banker days when she was at St. Francis Medical Center in Trenton. And midway during this pandemic, I emailed Judy and thanked her for her work and her daily presentations that were done with very great style and thoroughness, and gave me a lot of confidence that the pandemic was being handled well, and that has proven to be true, as she and the governor have really attacked the pandemic and brought it down to levels that are unprecedented in the country. So I want to thank the commissioner for all that great work, and we have more to do, and I'm sure she's up to that task, and we'll hear about that today. But my job is to introduce the sponsors, which I will right now. AmeriHealth, Associated Master Trust, AT&T, Berkeley College, Bristol Myers Squibb, Fallstrom, Hackensack Meridian Health, Horizon Blue Cross Blue Shield of New Jersey, IBEW, Investors Bank, Johnson & Johnson, LVE Group, McDonald's, New Jersey American Water, NJIT, NJM, Piper Holdings, Prager Metis, PSE&G, and Wedgwood Pharmacy. Without all the sponsors, there's no way we can continue to provide these programs. So we thank you all for your support today and your ongoing support in the past and going forward. So with that, I'll turn this over to Michelle Sakirka, who will introduce our speaker today. Michelle.
Thanks so much, Tom. Certainly, I am pleased this morning to introduce, as the governor would say, the woman who needs no introduction. However, we wouldn't be paying her the due respect that she deserves if we didn't tell you more about her this morning. Judy Persichilli began serving as the acting commissioner of health on August 5, 2019, and thereafter was confirmed by the state senate on January 9th of this year. Now, just think about that. You know, just a few short months before COVID-19 took hold of our state and our nation. Talk about jumping right into the pool. Prior to leading the department, she served as the acting chief executive officer of University Hospital in Newark, and also served as president emerita of Catholic Health System East, Trinity Health, earlier in the decade. Her expansive healthcare experience is just second to none. In 2006, she was inducted into New Jersey State Nurses Association Hall of Fame. Judy received her nursing diploma from St. Francis School of Nursing, a Bachelor of Science in Nursing, summa cum laude from Rutgers University, my alma mater, Judy, go RU, and a Master's of Arts in Administration, summa cum laude from Rider University. Obviously a Mercer County girl at heart, thank you. She has obviously been extremely busy in this unprecedented year, and we are grateful that she can spend time with us this morning. Everyone, please welcome the Department of Health Commissioner, Judy Persichilli.
Well, good morning. Thank you so much. Thank you to NJBIA and the Chamber for hosting this event. And special thanks to Tom and Michelle, who I have known for so many years and appreciate their leadership over time. Thank you for your support and advocacy for the business community, especially during this COVID-19 health emergency. While our department is focused on our mission to protect and promote the health of the residents of New Jersey, we recognize this pandemic has exceeded the bounds of a health crisis alone. Our lives, as we knew them, have changed. The way we work, go to school, dine, shop, all have been altered. Many residents are struggling financially, and the mental health impacts of this pandemic are ongoing. So let's start at the beginning. It seems like years ago, and yet it's only 9 months. The The department began preparing for a potential COVID-19, what we thought would be a small epidemic, back on January 24th. We established an internal crisis management team to monitor the emerging outbreak of a novel virus in Wuhan, China. On Super Bowl Sunday, February 2nd, I was notified by the CDC that the Newark Liberty Airport would be a funneled airport, and 350 passengers would arrive the next day from Wuhan. They would need to be screened and processed, and if necessary, quarantined. Over the next 12 hours, the department staff secured housing for quarantine, worked with the CDC staff at the airport to implement screening protocols, and secured a process with the Port Authority for security and transport. As a result of that initiative, one individual from Indiana found herself quarantined in New Jersey. On February 3rd, the next day, Governor Murphy signed an executive order calling for the creation of the Coronavirus Task Force, an all-of-government approach in response to the pandemic. Predictive modeling mid-March, based on data collected from acute care facilities in New Jersey, and using the CHIME model developed by Penn Medicine specifically to assess hospital needs, suggested that we could see between 10,000 and 80,000 hospitalizations with between 6,000 to 40,000 intensive care beds in use. The range of estimates for both hospitalizations and ICU bed use was influenced by the inclusion of measures of social distancing. If we had no social distancing, we could expect 10,000 to 80,000 on the high end hospitalizations. If we have 31% social distancing, it might come down slightly, but still over our capacity in New Jersey. And if we had 50% adherence to social distancing, we would just about make it. Based on the good work of the residents of New Jersey, we did hit, thankfully, the 50%. And we were able to take care of 8,300 admissions to our hospitals, April 14th and 15th, with COVID-19 diagnoses, with over 2,000, about 2,300 individuals in intensive care, and 97% of them needing ventilators. At the time, it was also apparent that the international supply chain disruptions would impact the availability of protective equipment and life-saving equipment like ventilators. In response, we set up an emergency operations center at the ROC, the Regional Operations Intelligence Center, which served as the nerve center for the management of staff, supplies, and communications. In expectation of the predicted surge, we divided the state into 3 regions, with the level 1 trauma centers as collaborating entities for each region. The hospitals were asked to double their critical care capacity. Elective surgeries were canceled. We called in the Army Corps of Engineers to stand up field medical stations in Secaucus, Edison, and Atlantic City. Additionally, we worked with the Corps and hospital systems to stand up closed hospital wings, and within 3 weeks, we added an additional 2,000 beds. The Coronavirus Task Force, established by Governor Murphy, met weekly as state departments prepared for new ways to work and continued to serve the thousands of residents in group homes, schools, shelters, early intervention services, and other direct vital programs. The department developed guidance for hospitals and long-term care to curtail visitors and enhance infection prevention strategies. In all, 18 guidance documents were sent beginning on March 3rd. On March 4th, we had our first case of COVID-19. When this first case was diagnosed, very little was known about the virulence and transmissibility of the disease. And by March 10th, we had our first death. In mid-March, the chief medical officer at Central State Medical Center notified the department of a severely ill patient in respiratory failure who had attended a family gathering on March 3rd. The family reported that another family member was in a Philadelphia hospital with similar severe symptoms. It was reported that the patient had contact with a known Bergen County case, and within a week, 15 family members from a family gathering of 25 had symptoms of COVID-19. On March 18th, the first member of that family died. Shortly thereafter, 4 more members of that family succumbed to the disease. It became apparent that the transmissibility and the severity of this virus was something we had never experienced in our lifetime. On March 16th and March 18th, the governor began mandating social restrictions, including closing restaurants, retail stores, and schools. The goal was to flatten the curve and decrease the transmission of the virus. Staff at the Rock began taking a full inventory of PPE throughout the state and began stockpiling supplies, especially scarce ventilators. The state began an unrelenting search for PPE and ventilators, from the White House Strategic National Stockpile to third-party vendors. The New Jersey State Police, its Regional Operations and Intelligence Center, and the Department of Health were literally moving ventilators in the middle of the night to ensure that all who needed care received it. PPE, protective equipment, was and continues to be in critical supply. By April 14th, our hospitals were experiencing the predicted surge, treating, as I've told you, 8,300 COVID patients and over 2,300 critical patients. Since that surge, fortunately, the curve has flattened, and our hospitals have seen a steady decrease in hospitalizations and the number of critical patients. Although we suffered a disproportionate percentage of deaths, and sadly, nearly half of our deaths were among residents, vulnerable residents of long-term care, we are now seeing mortality in single digits, thankfully. We've come a long way since the beginning of the pandemic, when testing was scarce. More than 3.2 million tests have been performed in New Jersey, and our positivity rate, which was above 5%, has fallen to less than 2%. Contact tracing has greatly expanded from 300 before the pandemic to nearly 2,000 contact tracers currently in place. We have more than 1,000 isolation and quarantine spaces for those experiencing homelessness or others who needed a safe place to quarantine from their loved ones. And the 24-hour hotline run by the NJ Poison Center has received over 51,000 calls from the public. We are now gradually reopening and preparing for a large-scale vaccination program when the COVID-19 vaccine becomes available. At the same time, we continue being vigilant for a possible second wave. The public health emergency has had an unprecedented impact on our state. As you may know, the New York metro area emerged as the first hotspot in the United States, and then every corner of our state was affected. There have been more than 200,000 cases, and sadly, we have lost more than 16,000 New Jerseyans to this virus. Throughout the pandemic, we have been concerned about the disproportionate impact of COVID-19 on vulnerable populations and communities of color. The same longstanding inequities that have contributed to health disparities over time affecting racial and ethnic groups have also put them at increased risk for COVID-19. For populations whose vulnerabilities are heightened by COVID-19, and for populations who are newly vulnerable to the virus, we have used a health equity lens in all parts of our response and recovery. As a result of the pandemic, the demographic of those who identify as at risk, under-resourced, and underserved has widened. We know that young Hispanic men are 2.5 times more likely to die than their white counterparts from COVID-19, and overall, Black individuals are 2 times more likely to die. We have made strides in increasing access to testing in communities of color. Our public health awareness campaign has a special focus on underserved populations, so individuals know where they can find testing. Every day we collect, analyze, and report data by socioeconomic characteristics and use it to monitor and identify vulnerabilities to inform how to target public health interventions and evaluate success. In addition to the grave health consequences it has caused, the pandemic has also unleashed an economic crisis in our state. As business leaders, you know so well, this pandemic has had a devastating impact on our economy. And businesses, small and large across our state, have faced and continue to face severe hardships, some having to temporarily or permanently close their doors, adapt to new ways to do business, been forced to lay off or furlough their employees, and have employees work from home, a new way to work for so many. So many of you have been resilient in the face of these challenges, showing the innovativeness American pioneers are known for. However, the financial challenges to businesses, individuals, and families have been tremendous, as have the mental health challenges. In struggling to stay safe and provide for yourself and your families during anxious times, we have seen an increase in the emotional well-being of the residents of New Jersey, and we have seen PTSD in our frontline workers. While we are thankful for the federal funding we received, the governor continues to advocate for more support from the federal government to help our state recover and become more resilient. As the state has reopened, the department has prioritized safeguards to protect the public. The department's guidance has put in place protocols for cleaning, mask wearing, social distancing, screening, installing protective barriers, capacity limits, and other necessary steps critical to protect the health and safety of the staff, the workforce, and the public. For those who can, telecommuting is still recommended. Face-to-face meetings and travel should be limited. Use of video conferencing when possible, and limiting meetings to smaller numbers of attendees is recommended. The only tools we have in our toolkit right now are our safeguarding tools: masking, social distancing, washing your hands frequently, respiratory etiquette. It's really all we have. As employers, you all have a vital role to play in ensuring a safe environment, not only for your customers, but for your employees. Protections such as barriers to protect workspaces, screening, social distancing, and masking, proper ventilation and cleaning and sanitizing frequently, again, is all we have. The CDC has a resuming business toolkit and offers a decision-making tool to assist employers in making reopening decisions, especially to protect vulnerable workers. That can be found on their COVID-19 page, www.cdc.gov/coronavirus/2019-NCOV. As I mentioned earlier, we have worked hard to make testing widely available and more accessible throughout our state, not only for our frontline workers, healthcare workers, vulnerable populations, or people who may have been exposed, but also for anyone who wants a test. For testing opportunities, visit COVID-19 Information Hub at covid19.nj.gov. We now have free testing sites in every county. Hand in hand with testing is contact tracing, both key pillars in the state's recovery efforts. Contact tracing is not new. It's a decades-old practice in New Jersey and throughout the world to inform and protect people from the spread of contagious diseases, such as measles, HIV, and now COVID-19. In our own small way at the health department, we are also supporting job creation. We have built up a core of contact tracers working with our local health departments in every county to meet our current needs. Building on existing staff and local health departments, more than 800 additional contact tracers have been hired to fill these well-paying jobs. We are creating a total workforce of nearly 2,000. So we are continuing to build our capacity to respond to future needs. They are well-trained and members of your communities. If you test positive for COVID-19 or have been exposed to someone who has, you will get a call from a contact tracer who will provide information how you can safely isolate to protect your family, your loved ones, even if you don't feel ill. A contact tracer will also tell you about social services that are available to help you if you are worried about providing for your family, such as food assistance or job protection. A tracer will also ask who you've been in close contact with prior to your test, if you have any symptoms, or when you first experienced symptoms. A close contact is someone who has been within 6 feet of you for more than 10 minutes. Those individuals may also have been potentially exposed through no fault of your own, but require testing and follow-up to protect them and their families as well. All information is confidential. No one will ever ask for Social Security number or financial information. Contact tracers are simply doing their job to help protect public health and to help stop the spread of this virus. To support our contact tracers and our contact tracing efforts, we will be launching a digital notification app that, once downloaded, will alert you if you have been exposed. But success requires everyone to do their part. If you get a call from a contact tracer, please answer the call and share information on your close contacts to ensure that they too can get the help they might need. Too many of our residents who answer the call are still refusing to share their contacts. With schools, gyms, restaurants, and other reopenings occurring, having a strong network of contact tracers is more important than ever to contain the spread of COVID-19. To reduce the spread of the virus in our state, we are also asking individuals who have traveled out of state or other virus hotspots to quarantine for 14 days and monitor for symptoms, even if they don't feel ill. Weekly, the state publishes a list of states that are experiencing high COVID-19 activity. We ask that travelers fill out an electronic survey, which is accessible by texting NJ Travel to the number 898-211, by visiting covid19.nj.gov/NJ Travel, or by scanning a QR code on posters at the airports. Travelers can bring up the form on their phones through any of these actions. Once they have filled out the survey, the information will be directly submitted to their county health departments. Once the health department receives the traveler's information, we are asking them to call the traveler to remind them of the request to self-quarantine, make sure they know where they can go for testing if needed, and ascertain if they have any other needs related to self-quarantine. The self-quarantine advisory is voluntary. We are relying on personal accountability. Compliance is expected. I would be remiss if I did not bring up flu shots. We are still working to contain COVID-19. As we are still working to contain COVID-19, we are also preparing for the possibility of a twin-demic, a seasonal flu overlapping with a second wave of coronavirus. For that reason, it is critical that as many residents as possible get the flu vaccine as soon as possible. I already received mine last week. While flu vaccine cannot protect you from COVID-19, it will help reduce flu illnesses and help keep you out of the doctor's offices or the hospital emergency rooms. Getting a flu vaccine is easy, and it's recommended annually by the state health department and the Federal Centers for Disease Control for everyone aged 6 months and older. Although flu season can extend through the early part of next year or later, it is essential to get the vaccine as early as possible to ensure the most protection. That is why the CDC recommends you get one before the end of October. For our youngest and oldest residents, pregnant women, and those with chronic health issues, getting the flu vaccine is especially important. Large-scale COVID-19 vaccinations are our next frontier. We are planning to vaccinate 50 to 70% of the population once a vaccine is available for wide-scale use over a 6-month period, between 5,000 and 6,000 vaccinations daily in every county. A daunting undertaking. I know this has been a challenging time for businesses in New Jersey, and it unfortunately will be going on. I know your bottom lines have all been affected, and they have had to conduct, well, every single one of you have had to conduct business in an entirely new way. This is a once-in-a-century virus. You are working through history. Some of you are making history. This virus is virulent. It's relentless. It's extremely efficient. We all have a role in working together to save lives from COVID-19. So thank you to all of the members that have committed to taking care of yourselves first and foremost, your loved ones, and to reopening safely and protecting the lives of so many. You are all a vital part in our fight against COVID-19 in our state. Thank you so much.
Commissioner, thank you so much for those great comments. In a moment, I'm going to turn it over to Christy and Mike to ask some questions, take some questions from the audience. But I do want to acknowledge and recognize, thank you for recognizing what the business community has done during this time in terms of stepping out to safeguard their workforce, as well as all of those who frequent their facilities. We all have been working tirelessly with the business community on how to safely reopen. And I guess the first question I want to ask before we hand it over is, what more can business do? We've been checking the boxes. We've been taking the pledge. We've been being trained on safe work environments. We've been following the rules. And I know the biggest thing on the business community's mind is, what more can we do to send the confidence to our state policymakers to help us to continue to increase capacity so that we can save some of the businesses that are struggling today?
I think I suggested, by the way, in my remarks that, we are seeing an uptick in a couple of our communities. I think the best thing the business community can do is be aware. We do share statistics on our website, and I encourage you all to access the New Jersey Department of Health website and look at your counties. And for those that are seeing an uptick, and right now we're seeing it in Ocean County, Monmouth County. We're concerned about Gloucester, Middlesex, primarily. We're keeping an eye on Bergen. Look at the statistics. And if you see that there's an uptick in your county, double down on your safeguarding messages to your employees, to your public that you are serving. I know that most retailers and businesses in New Jersey, by the way, because I am in New Jersey, are doing a phenomenal job. But you can also be an active spokespeople for the work that we have to do. So that, first and foremost, from my perspective, would be the most important thing. The second thing, when we do have a vaccine, learn about it. Get the information. Be aware of the vaccination points of distribution in your county. Encourage your employees to get vaccinated, but do it from a lens of knowledge, because you know that vaccine confidence is one of the biggest issues that we're going to have with the COVID-19 vaccine, that we have with all vaccines, actually. There's a lot of hesitancy about vaccines. I understand that. I want everyone to be knowledgeable about the COVID-19 vaccine and be able to speak to it from that knowledge base and encourage people to learn and to consider getting vaccinated. That will be the only way we will be able to return to a full reopening. And that will take us through the year 2020. So masking, social distancing, washing your hands, respiratory etiquette, that will continue even as we are vaccinating individuals to bring us to a point of what we call community protection. Some of you may have used the term or have heard the term herd immunity. It's really what we're looking for is community protection. Enough people vaccinated or with antibodies that decreases the spread of COVID-19. And I'll finish by telling you that part of the phase 3 studies that are going on with the vaccines to determine the safety is also to determine the long-term immunity of antibodies. This novel virus, we've never seen it before. We don't know how long the antibodies will give you immunity, but that's part of the studies that are going on.
Commissioner, I would tell you that your proposal about watching the daily numbers and doing it by community and by county, we made a proposal. The business community has made a proposal several times to regionalize opening around the state by looking at those numbers, which are that do come out daily. We've made that proposal, and we also said that by watching those daily numbers, we could then find out hotspots as they popped up and start to retract openings if there were hotspots that needed to be addressed. So we are very vehemently on that concept. We've made that proposal several times, and we're very aware that the numbers are available, can be followed, and would guide us in opening and retracting from opening or restricting the openings if the numbers became out of control. So we hear you. We're following that. We're trying to get the economy open by following exactly what you're saying. But so far, it's been resisted.
Well, let me respond to that because I look at the state on a statewide basis. The number of cases is just one indicator. We actually look every day at 10 a.m. at a series of indicators that the epidemiologists prepare for us and evaluate. Cases, new cases, is just one. The rate of transmission, as you've seen probably we share at the press conferences, is another. We monitor every day influenza-like illness and COVID-like illness symptoms coming into every emergency room in New Jersey. They are two of the most important indicators. We also look at positivity rates regionally and in New Jersey. We look at cases per 100,000. That is just a snapshot of what we look at every day. So it's not just new cases. So you can't just say there's an increase in Ocean, let's close down Ocean because there's an increase in new cases. We have to look at the positivity. We have to look at the rate of transmission. We have to look at who's in our emergency rooms with COVID-like illness or influenza-like illness. We have to look at the population base and the cases per 100,000. So we put all of that together when we look at the state as a whole. So I don't want my comment about looking at the county new cases to be the only thing that we look at, and that decisions should be made just on that indicator. That is not what I meant.
Our proposal included about 6 or 7 different medical metrics, including all of what you said, plus looking at the capacity of hospitals in those regions. So we were not focusing on one number. We were focusing on a variety of numbers, all of which you just mentioned.
Yeah, I think the key, Commissioner, is that our proposal suggested that we go regionally because we can handle things best within our communities, as you stated, boots on the ground. We don't want to see a de novo shutdown of the economy again, as we had to do in March. Given those circumstances, we understand. In the event of a resurgence, we are hopeful, and we have advanced the ability to look community by community on those series of metrics and say, let's focus in by region and take action by region, not de novo across the state all at one time. That rounds out the proposal that we have advanced to the governor.
Well, I'd like to talk more with you about that, Michelle, and maybe sit down and show you the variability and what pops up and pops down on a daily basis. So I'm not sure whether you would be making your decisions on a 7-day rolling average, a 14-day rolling average. What if we see a surge, which, by the way, we're expecting? It's not as simple as just looking at one set of indicators and making a decision for reopening. So I would love to sit with you and be happy to go over what that looks like on a daily basis. Might give a better idea of what we could do together.
We wholeheartedly welcome that and look forward to following up on that, talking more about this regional approach with metrics. Thank you so much, Commissioner.
Commissioner, let me ask you a question going back to your CDC toolkit comment. One of the big issues in the business community is to get liability protection to mitigate, to avoid frivolous lawsuits that are going to come out of people contacting the disease in different places of businesses or retail stores. Would you think that if legislation was crafted for liability protection based on conforming to the CDC toolkit, that would be appropriate?
Yeah, I don't comment on things like that, Tom.
Okay.
Percy, you have a question? Yep, absolutely. Commissioner, thank you for your time this morning. And let me also just acknowledge and thank your team who we've been in touch with throughout this pandemic, who I know have been working 7 days a week in addition to you, and also to our healthcare providers who are on the front lines who are joining us this morning as well. I know it's been a tough time for everybody, including obviously our business community that has been operating at a limited capacity or has been closed. You acknowledged the work that the business community has done to protect its employees, its patrons, our students on campuses and such. And so we do appreciate that, because many folks are going above and beyond and doing everything that they can to make sure that they can open safely. A couple of key things you touched on was the vaccine. And I know Dr. Fauci joined Governor Murphy to talk a little bit about that last week. And I believe the vaccine might not be available to the public until the second or third quarter of 2021. Additionally, I know the governor announced yesterday more testing coming to New Jersey, which is positive as well. So can you talk a little bit about if the vaccine is coming a bit later or in 2021, but we're also having more contract tracers and more testing coming into New Jersey, how this will all kind of mesh together so that our business community has some predictability on, increasing those capacity limits that are set in place currently by the governor's executive orders.
Well, the first thing is, a large-scale vaccination program. I think I gave you an indication of how many people we need to vaccinate just to get through a 6-month period once the doses are available for the general population. There's two schools of thought about when the vaccine is going to be available. Some believe that there may be one tranche for vulnerable populations, essential workers. By the end of the year, that's a possibility, but the question is how many doses we'll get. We've not seen a formula yet that will identify the number of doses per state. I would have to suggest, because New York and New Jersey were so disease burdened first, that we might get a little bit more, but it could be that we get 80,000 doses for the 4 million people in New Jersey that would fit into a vulnerable population definition. So we do have a professional group that would be working with us to determine the priority and the allocation of scarce doses. I expect perhaps maybe by the end of the year, some small doses. We track all of the major pharmas and where they are in their phases. We think perhaps Moderna may come out with something sooner than later. However, it would be a 2-dose regimen, 21 to 28 days apart. It would require cold chain storage to as much as minus 90 degrees centigrade or Fahrenheit, excuse me. So we're looking at how many generators and refrigeration logistics we have to respond to. So all of that is just a long way of saying we're preparing for large scale, probably towards the end, and this might be a little sooner than what we actually see, but the end of the first quarter. So again, all of the safeguarding that we have in place has to continue. That's all we have. And if we get wide scale by the end of the first quarter, and we can effectuate 5,000 to 8,000 doses a day in each county over a 6-day period, we might be able to vaccinate everybody in 6 months.
Commissioner, in connection with that, we really appreciate and thank our pharmaceutical members that are really stepping up and helping out, in addition to a lot of our member companies at the beginning of the pandemic that with their stockpile, shared PPE equipment, as you know. I think they were always afraid that there was going to be another 9/11, so they were prepared, and I know they helped you and the governor out with that. One of the challenges that I see, and I saw it last fall and winter when I was in the State House, I couldn't believe how many anti-vaxxers showed up in the State House and flooded the State House tunnel that connects the State House and the annex. I mean, I haven't seen a group in my years in Trenton come out en masse. How will the state, and hopefully along with the private sector, meet that challenge and educate and inform and somehow convince those folks that they have to be vaccinated as well? Because I was, as I said, Commissioner, I was very surprised at the amount of people that came out. And do you think the state will have sort of an education outreach process to alleviate any of those concerns or any of the misinformation that might be out there?
That's a great question. It's a concern of ours. If you were at the State House during the demonstrations of the anti-vaxxers, I want you to know that that was the day of my confirmation hearing. So I was very aware. I was very aware of the chanting and the drum beating. We are home to many, many anti-vaxxers. Our goal, and we're starting that this week, is to have a series of stakeholder phone calls. At the beginning of the pandemic, we actually had over 300. The governor joins me on many of them. And the stakeholder phone calls are to increase awareness, hopefully educate, and promote. In this regard, we'll be promoting both flu vaccine and COVID-19 vaccine. But we do expect a significant issue with those that are hesitant about vaccines or downright disregarding the value of vaccines. We'll just have to work on it every day.
Well, you have a partner in us from the business community. If there's any way that we can, put that word out to our members, please, you and your staff, use our resources where, we can communicate to our members whatever you and the governor are putting together in that light.
Thank you.
Commissioner, yesterday the governor announced the receipt from the federal government of a significant number of Abbott tests called, I think, Binax Now. And he made the comment that this is a game changer. Is it a game changer simply because of the number of tests we have and how quickly the tests can be, the results can come from those tests? Or is there some other reason that the comment game changer was made by the governor?
Yeah, that's a great question, Tom. The Abbott Binax Now is an antigen test. An antigen actually detects whether you're shedding. It looks for particles of the virus, whether you're shedding the virus. Up to this point in time, some of the antigen tests have not been especially at the level of specificity and sensitivity, that you feel confident with the results without follow-up PCR test or the molecular test. So number one, the specificity and the sensitivity of the Abbott Binax is 97.1% and 98.5%. Very, very high for an antigen test. So that in and of itself is a game changer, because if you have high specificity and high sensitivity, there's a good chance that the result that you get, positive or negative, is almost 98% acceptable. The second part that makes it a game changer is the delivery method. There's no medium, there's no refrigeration, there's no transport. It's a card. Swab your nose, both sides, swipe it on the card, and it'll identify whether you have the virus or not. That's pretty significant. The challenge for us is to make sure that those results, positive and negative, get into our communicable disease system so we can track it. But when you don't have the logistics of a test kit, of a test tube, of medium, of saliva into a test tube, when you just have to swab and swipe, huge game changer.
So will those test kits be only available to the medical community or the state health community, or will they eventually be made available to office complexes where they can test people as they go into the office?
Yeah, that would certainly be our aspirational goal. Right now, the Abbott Binax has a contract for delivery only to the federal government. So we cannot go on the open market and buy from Abbott. It's not a kit, it's a card. It's a card and Q-tip. It's something that looks like a Q-tip. My understanding is New Jersey has been allocated over time 2.4 million cards. And they are to be distributed to test vulnerable populations, frontline workers, visitors into congregate settings, things like that. After the first tranche, which is under federal government, it will go to open market. That's when situations like you just described would become more available.
That's the real game changer when it gets to that level.
Well, the real game changer is when it's going to be a game changer. Look at long-term care. There's a lot of discouragement because we have such conservative guidance for long-term care. If you can test employees and visitors into long-term care with a swab and a swipe, you can stop the flow of virus into long-term care. And that's what we have to do, because we are still having some outbreaks.
Commissioner,
Thank you.
I have a question. Thank you, Tom. I have a question related to the future of healthcare. Clearly, things are going to change with the delivery of how our healthcare is provided, and our business community has prided itself on being able to offer healthcare and health insurance coverage to our employees. With the pandemic, we do expect more folks to go on to Medicaid and other types of assistance to get healthcare coverage. So I was wondering if you could just touch upon, what the state is looking to do as it relates to funding, if this in fact does continue to be a trend. And also, can you touch upon some of the changes that were done or put in place to address the healthcare needs of the population during the pandemic, such as allowing APNs to prescribe without physician supervision? How is that working? And also telehealth.
Okay, what do we have, a couple hours now?
Yeah,
This is a great topic. You know that the governor has, and it was before the pandemic, put in the Office of Healthcare Transformation in the governor's office. And Shabnam Salih, who is the head of that, works very closely with Department of Health. And I can't think of a better time for that office to get up and running to address some of the items that you brought up. I'm going to start at the end. You talked about the waivers that are in place. We have kept all of the waivers in place. For example, the APN and the use of telemedicine. We've kept the waivers in place not to hold the hospitals back from increasing their critical care licensed beds or their hospital beds. We did that purposely, and we want to keep all of that in place till we have some assurance that this is under control, so that we have a lot of fluidity with how we manage in the healthcare space. So the waivers will stay. I think we're learning a lot about what advanced practice nurses can do, what telemedicine can do to respond to the needs of the residents in a safe way. And I think that's one of the issues that will continue long term, way after this pandemic is under control. As far as insurances are concerned, I can't think of a better time to put in a plug for the ACA and Medicaid. The ACA, we cut our Medicaid rolls in half when the ACA took hold for those that could get insurance under the Affordable Care Act. Between the ACA and Medicaid, we would expect that people will be covered in New Jersey. Medicaid is administered, as you know, out of the Department of Human Services. There's been a lot of money put back into the system to support the mental health needs that we're seeing coming out of this pandemic, to continue our work on substance use disorder with some of the monies that have put into the availability of, for example, of Narcan. Medicaid is a matching program with the federal government. We expect it to continue, hopefully, and that the ACA will be available for residents as well. A lot of that will depend on what happens politically over the next, 6 weeks.
Commissioner, going forward, we've all readjusted. Obviously, we would have done this event live at some hotel with you, speaking up at a podium, and, we go to webinar and Zoom and all those platforms. Do you see going forward, in your opinion, changes both public and private sector? Are we going to see the handshake as sort of a thing of the past and continue to elbow each other and things of that nature? What are the life lessons that we take from the pandemic? And simple things like, do we even see salad bars anymore, or does it could come back down the road when everything levels off? Just want to get your opinion on those things.
Yeah, thank you. I think we have to learn from this pandemic. There are some that say that this was not totally unexpected. Whether you listen to Bill Gates or, pundits that said we're going to have a pandemic, well, we're going to have another one. I don't know whether it's going to be in our lifetime. This, like I said, is first in a century. But we have to change some of our behaviors. The handshake and the hug probably is a thing of the past. I think hand sanitizer, washing your hands frequently, is going to and should stay with us. And we are seeing, by the way, in the Southern Hemisphere, with all of the safeguarding for COVID-19, we're actually seeing a decrease in flu transmission. So that's a lesson. We have to continue protecting ourselves from viruses that are unseen enemies that we know will be among us. So yeah, I think we should not turn our back on the lessons that we're learning, and part of that is safeguarding ourselves on a regular basis.
Commissioner, I know you're aware of the question I'm going to bring up from one of our members, but Microsoft has announced that they're not going to support Internet Explorer in the future, and clearly this will have an impact on some of the systems, especially for our postmortem activities and such. obviously, they want to make sure that there are opportunities to discuss strategies to address this. And I was just wondering if you could just touch on this issue a bit.
Yeah, thanks for saying that. We're aware of that interruption. We actually have received a grant to be able to support a transition to a system that people will be able to use, hopefully with no interruption in that.
Thank you.
Commissioner, because the contact tracing is so important in this whole process, I think you mentioned that we have 800 of them right now, and the goal is to get 2,000. And I know you're having difficulty in recruiting people to become contact tracers. What are you doing to try to enhance that recruiting?
We started with 800. We're up to actually about 1,700, I believe, right now.
Okay.
So I may have misstated that. We went from 300 to 800 to 1,700. Our goal is to have probably 2,000 more. We've contracted with a staffing agency to help us with the recruitment and the onboarding. And as you know, Rutgers has set up the online training program. I think it's a 15-hour training program. When Rutgers first started, we contracted with Rutgers in the beginning, and they required undergraduate degree or a graduate degree because it was primarily their students. Now we have identified a high school education as a requirement, and with the appropriate onboarding, we expect that we will have enough. We will have enough contact tracers within the next 2 to 3 months to fulfill our goals.
So one question for me that's been bugging me from day one, and that is, we have all the medical data that you get on a daily basis, and you talk about all the medical data. Which of all those data is the most important daily statistic that you look at?
Right now, I can tell you that what I look at, there's not just one statistic, but I do look at our activity in our emergency rooms. COVID-like illness, influenza-like illness. I think if we look back to December and January, we had a late surge, an increase in flu-like illness in our emergency rooms. And we had appropriately interpreted it to be a really bad flu season. And this was nationally. So of course we're going through those records, and we're seeing now it's a good possibility that some of those individuals had COVID, that it was in our community long before we knew it. And the difference between flu-like illness and COVID-like illness is pretty slim. So at the end of the day, there's a good possibility that we will see emerging significant issues by keeping a really close eye on what's going on in our emergency rooms.
And interestingly, when you talk on a daily, it's your daily or 3 times a week press conference right now, I don't think you touch on that issue.
Well, and I wouldn't, because the trying to explain COVID-like illness and influenza-like illness and the symptomatology and the differences is what our epidemiologists do, and they do it on a regular basis. You know, there's just so much information that you can give at a press conference. You're speaking to the general public, and you want to alert them. You don't want to panic them. You want them to give general knowledge, but we're talking about epidemiology now.
Yeah.
So, you know, if I went through the symptomatology, you'd be sitting there saying, uh-oh, it sounds like almost the same. And it is almost the same, except there may be a different respiratory presentation in COVID-like illness than influenza-like illness. It may be that an influenza-like illness, if you got the flu, it comes on fast, you spike a fever, and you end up at the doctor's. COVID-like illness actually comes on slowly and then fast. So the history, I mean, this is very, this is medical science, very complicated epidemiology. It's what the epidemiologists at the Department of Health look at every day.
Commissioner,
I think we're at our hour, and I want to thank you on behalf of the BIA and the Chamber for being here today. And again, the work you've done along with the governor has been phenomenal. And I think, again, the style with which you've conveyed all this information, the transparency that you've used in talking about the pandemic, and the thoroughness with which you provide information at your press conferences have not panicked anybody. In fact, for me, it's given me a lot of comfort, and I think a lot of people are comforted by the fact that you are on top of this, working with the governor. And again, thank you for being here, and congratulations for all you've done for the state in bringing this pandemic down to a very manageable level.
Thanks, everyone. It was an enjoyable morning. Michelle will be in touch.
Commissioner, we will absolutely be in touch, and we appreciate that offer on your part, and we certainly will take you up on that. Thank you. Have a great day, everyone. Thanks for joining.